Thank you very much, Mr. Chairman. I'm Sam Hickman. I'm the director of the West Virginia chapter of the National Association of Social Workers. Have been for close to 29 years, and it's been my privilege to be a social worker and to work on behalf of social workers and the people that we serve around the state of West Virginia. I brought some of the 200 practitioners, students, and faculty of social work who are here with us today, and I apologize for the disruption because I was not being a very good tour guide at that point, but we did get them here, and I'm so pleased to be before your committee. And I can tell you, just to echo Bob's thoughts, this committee is certainly near and dear to all of our hearts. What you are doing is what we think the state of West Virginia needs to do to move forward, study these issues. Social workers are with you in that regard. We can be an excellent resource to you. Sometimes you have to reach out to us. We don't tend to be terribly flashy. We spend most of our time advocating for others and sometimes don't do as effective a job for advocating for our profession. But as I tell social workers, if we don't make sure that we're here with the right education and the right numbers, with the salaries that are commensurable with our experience and the dedication with which we serve, then we are not going to be here to serve the people and the needs of West Virginia and other states. I am here because Gary McDaniel, who was scheduled to speak with you today, who is a clinical social worker in Morgan County, is socked in by the weather. Gary is an unusual hire for the Morgan County Board of Education. He is a licensed independent clinical social worker. He was hired to do that work in the school. He's been working on anti-bullying campaigns, on healthy lifestyles campaigns, working with teachers, the community, family members, churches, and students to really implement the types of programs and connections that need to be done to assure school readiness and success. Helping teachers, for example, understand what really is happening in the home of some of these students, taking teachers to the home, being that kind of connector and resource. He's got some wonderful stories and has actually become a national presenter on school bullying prevention, along with his son, who is still a student at Morgan County High School. And they will be presenting the keynote address at our National Association of Social Workers Conference here in West Virginia on May 1st. But I'm proud to say that he has been asked to speak at Harvard University, he and his son. They've been asked to speak for a Google conference, national conference is coming up, and I've just heard wonderful things, stories coming back to West Virginia about their work around the country. As I say, Gary is unusual because West Virginia's system of social services in the schools grew out of the old truancy model, the truancy director. So we have what are called attendance directors, who county boards of education are mandated to have an attendance director, or at least a half-time director. And counties may then hire, as they see fit, additional attendance directors. So you will find, particularly in larger school system counties, many social workers who are titled assistant attendance director, but they are trained as social workers, they are degreed as social workers, they are licensed as social workers, and locally they are called the school social worker. Then you also have Title I schools that have a high number of minority and low-income populations that are required to have a social worker, a psychologist, a counselor, and other dedicated to them. I am also interested to see what happens in McDowell County because they have invested heavily in their own school social work cadre. The high schools down there have 4 master's level social workers working with them, and I'm just beginning to get contact and stories from those folks who are doing some good work down there. So we really see ourselves as the connection between the home, the community, and the school. We are working with the families and with the communities to do the things that need to be done to help students succeed. If we are able to be successful, we think families and students are going to be more able to be successful in the future, and we can break the cycles of poverty and truancy and apathy and substance abuse and pipeline to the correction system that we find so often. But we need to be allowed to do our work in as many expansive ways as possible. When people think of social work, they tend to think of the Department of Human Services and our work in protective services and youth services and other areas. Our mental health hospitals and whatnot is very important, but it is only one picture of social work. Social workers are in the court system, in hospitals, hospices, nursing homes, psychiatric facilities, schools, communities, religious organizations, community organizations, mental health centers, private practices, primary care centers, primary care clinics, and public welfare and more. And what I want to speak with you today about is an opportunity to expand access to mental health services. There has been a great clamor for access to mental health services in this country because of the confluence of events, awful events, and systemic and chronic events, including gun violence, truancy, substance abuse, not having students who are ready to pursue their education, families in crisis, grandparents raising grandchildren, and our correction system as well. When I look at the system, I see that we have limited access to mental health services in West Virginia and many places around the country. What folks often do not realize is that licensed clinical social workers are already providing 60% of the mental health services in the United States. They're doing it in private practice and group practices. More commonly in West Virginia, you will find them being reimbursed for services through the auspice of a licensed behavioral health facility. And what I want to posit to you today is that by allowing our Medicaid program to independently reimburse these licensed practitioners who are by law independently qualified to practice, licensed independent clinical social workers in West Virginia are qualified in the same manner that the federal Medicare law requires. They are independent practitioners by license. They are allowed to assess, diagnose, and treat mental health services. In many of our courts, they are allowed to evaluate for mental health status prior to a commitment proceeding and those sorts of things. What this will do, I believe, is open access to mental health services, individual and family services, to low-income people and folks who do not have it now. Folks who are being released from our prisons, folks who need substance abuse treatment options. They're not all going to be able to get inpatient treatment. Kids and families who are struggling with just being at loggerheads and needing to get their own situation straightened out. They don't really have access to the individual kinds of therapeutic services that would be very valuable to them. When I've spoken with, this has been on our burner front and back for 30 years, and it's just another opportunity for us to speak with you about it because of this confluence of events. When I speak with the Bureau for Medical Services about this, they are concerned, of course, about the cost. I cannot give you figures. What I can tell you is that you're probably paying a middleman for many of these services, and that the numbers of services that you're going to be adding for folks, particularly in the low-income population, in the Medicaid population, are going to be matched by the federal match. And with the prospect of Medicaid expansion in West Virginia, they're going to be matched at 100% level. So those are considerations that lead me to believe that there is nothing that would more dramatically improve the access of mental health services in West Virginia at the most reasonable cost to the state than providing direct reimbursement to licensed independent clinical social workers in West Virginia. I know it's not something that you all can decide. It takes a state plan amendment. But your interest and knowledge about this will go a long way toward asking the right questions, getting the right studies, figuring out the right dollar signs and the numbers. The other question I get asked is, well, will our licensed independent clinical social workers leave their employment and go into private practice? And I say, one, they're not going to do it on Medicaid rates, but I can tell you this, social workers are much more likely to see a low-income person on Medicaid and accept that rate of reimbursement than any other licensed mental health practitioner will do. They will provide that access for you, and they will do it in the communities of the state where it is needed the most. The other thing is that they are dependent, as most of us are, on our employment for our retirement, our health insurance, and those things. And they are dedicated professionals. They're not going to leave their mental health centers. They're still going to stay there, provide treatment and supervision as they are now. But they are likely to open up a very small private practice on the side in which they will see Medicaid clients, low-income folks who really, really need care that they do not have access to now. I know our time is running short, and that is the message I just wanted to get across to you today, that we can provide those connections for you, we can provide those services for you if we are just given the chance to do so.